All right, here we are starting with section 9.1 part 2 and looking at the processes that occur when you utilize different physical and chemical methods to kill microorganisms. So sterilization and disinfection are a process. Each are their own process in which you are trying to either kill the microorganisms or halt its metabolism. So if you have something that is bactericide, if you remember, side is going to indicate death. And so this will be a chemical or a physical means that destroys bacteria, except for those at the endospore stage. Fungicide is going to kill fungal spores and fungal vegetative cells. Virucide is going to inactivate viruses. Remember that viruses are not considered alive, so you can't kill them, but rather you inactivate the active virus. Sporicide is an agent capable of destroying bacterial endospores. This is going to be very strong because bacterial endospores are very thick. They have that thick, hard shell, so to speak, with the calcium deposits and the dipicolonic acid in that outer core. Germicide, microbicide are chemicals that kill microorganisms in general. All right, another term or two terms here are sepsis and asepsis. Sepsis is the growth of microorganisms in the blood, and a distinction, a very important word here in that definition is growth. It's not just simply the presence of bacteria in the blood in your tissue, all right, because you can have bacteria in your blood at very small levels quite frequently. If you're eating Doritos or tortilla chips or even potato chips maybe, and you get a sharp or a thick corner of a chip that somehow you're chewing it wrong and that corner hits the roof of your mouth or at the gum, and it actually slightly penetrates your tissue, all right? You have a micro abrasion or even a large abrasion, or when you bite the inside of your cheek. Your mouth is a dirty place, and so any abrasions within your mouth, you're going to have inoculation of the bacteria from your mouth into that tissue, into that area. And so we actually have microorganisms at very, very low levels randomly running through our blood and in our tissue. All right, but it's very small, and so our system can take care of it before the microorganisms have a chance to establish that high growth process. All right. Asepsis is going to be any practice that prevents the entry of infectious agents into sterile tissues and preventing infection. So you want to be able to utilize aseptic technique when you're in the healthcare system so that you don't inoculate someone. All right. You want aseptic technique when you sample something from the lab or in the lab. You don't want it contaminated with extra stuff. Likewise, if you are injecting someone with a vaccine or drawing blood, you want to clear away as many microorganisms on the surface of that skin before you poke their vein with a needle. Because if their tissue is dirty, you're taking that dirt from the outside and directly putting it into the bloodstream. And that's kind of dangerous. So you want to use aseptic technique to try to avoid creating the situation where you might find yourself having sepsis develop. All right, antisepsis, antiseptics, chemical agents that apply directly to exposed body tissue. So here, the skin and mucous membranes. So you have wounds, surgical incisions to prevent vegetative pathogens. When you have a shot, when you have blood drawn, they clean the area with alcohol, let it sit there, let it dry, and then they poke you. All right, with surgical incisions, you're going to have more than just alcohol there because it's pretty major. And so they're going to probably use beta iodine to clean the area. And this is going to occur in surgery, at least, is going to occur in a sterile surgery room or disinfected surgery room. All right, so that stasis or static means to stand still. All right, you don't want to be static for very long. You want to be able to get up and moving for the overall health of your body. But for bacteria, it's nice to actually halt their metabolism. So if there's only 10 cells there, in an hour, there's still only 10 cells there instead of 40 cells. Because after 30 minutes, maybe the 10 have replicated to 20, and then another 20 minutes, that 20 has replicated to 40. So if it's bacteriostatic, it prevents the growth, right? Just prevents the growth. Fungistatic prevents fungal growth. And antiseptics and drugs often have microbistatic effects, right? Because some of those microbicidal compounds can be toxic to human cells. But also, if you have a clear understanding of our body, we have a very good immune system. So if we have an infection and we can simply stop the microorganisms that are causing that infection from expanding, then our immune system can actually come in and clear away that organism. So we don't actually have to kill everything, just halt it and let our own immune system do what it was designed to do. All right, so what is microbial death? Death is the permanent termination of an organism's vital processes. All right, it is going to prevent the organism from being able to reproduce, all right, to replicate itself. And that's going to be permanent loss. So, because microbes don't have actual vital signs, they don't breathe that we can tell. I mean, they go through cellular respiration, but we can't measure the rising of the chest. We can't measure a heartbeat. And so death is actually difficult to determine. So what you would have to do is try to kill something off and then take a sample of that and put it into a new environment that has the right temperature, has the right moisture, has the right nutrients. And if nothing grows, then you know you have achieved death. That's actually a very common practice to do. All right, you say you killed it, but do you know you killed it? So again, you just give it, swab it, streak it across a petri dish, an agar plate, and see if anything grows. And if nothing has grown, then you know that sample doesn't have any live bacteria. All right, the last slide of section 1 is going to just look at the different targets of the cell that the physical and chemical agents can be focused on. All right, so there's 4 of these, and this is objective number 4. The cellular targets are the cell wall, the cell membrane, cellular synthesis in terms of those macromolecules, and then proteins. All right, so then the effect, the cell wall, all right, it can block the material. The agent can block its synthesis. It can digest or destroy the cell wall. And examples are going to be chemicals, detergents, alcohols, the cell membrane. Detergents are good agents at disrupting the cell membrane. And then moving down the line. So section 9.2 is going to look at the physical options of targeting these different cellular areas of the bacteria cell. And so we'll look at those individually.